and doing HIPAA risk analysis for a lot of clients across the state. So yes, so welcome, Amy. Thank you. And we look forward to your presentation. You can use it.
Hello. All right. So I can walk around. I don't have to stand still because my brain won't work if I'm not walking. Is it okay? Okay, yay. But I have to go only do this tape? Okay, I can do that. All right. Okay. All right. Well, so I am Amy, and HIPAA's my thing. So HIPAA may not be your all's thing, probably not most of yours, or at least you don't think that it is. But actually, when I get done with you today, you're going to realize that even if you're not the HIPAA security officer, you're not the IT director or the compliance director at your organization, HIPAA's your thing. You're going to need to make it your thing and know a little, know a little bit more about it. When we're done today, you will know. Because what I like to do is I like to educate. Thank you. Does that work? Okay, good. I want to educate on the HIPAA rule. So ransomware, you saw that in my title, right? What's the one thing that all of the discussions that you've heard today, you can't do any of it without what? You're collecting data and you're making changes and you're doing attestations and you're submitting quality. What are you doing? What are you doing all of that on? Starts with a C. Computers, right? Well, guess what? If you get hit by ransomware, you can't do any of that stuff for a while. So you don't want that to happen. So I think they put me in this last spot. This is what I want to believe. I want to believe it's because I need to relate to you how important it is that you know more and you do take seriously all of the safeguards that are part of the HIPAA security rule, because we've got to safeguard our computers so that we can continue operations, so that we can see our patients every day and we can treat our patients. It will affect each and every one of you from top down, bottom up, if you cannot use your computer. All right, so let me just give you a little bit of background with HIPAA. HIPAA security, there's HIPAA privacy, there's HIPAA security, and there's HIPAA breach notification rule, right? Privacy goes back to the mid-late 90s. Security came around and was made official in 2005. And that came about because of computers, because we were now storing, transmitting, processing our patients' data on computers. And so OCR, Office of Civil Rights, said, all right, we gotta protect this stuff. We gotta be really careful about how we share our patients' data. So we write this rule called the HIPAA Security Rule. It's a part of the privacy rule. And it set forth what are called standards and safeguards for protecting that electronic protected health information, which is EPHI. But you know what? In 2005, were you all working in healthcare in 2005? Only Jared wasn't. Everybody else was. Well, I wasn't. So if that matters. Well, even though you were required to do security risk assessments in 2005, I bet you $5 you didn't. And I bet you didn't until the meaningful use rule came along. And then, because that's where I was in healthcare in 2010. And so it was my job to, get these doctors on these EHRs and get these attestations and go get that incentive money. And what was objective number one? Well, in the very beginning, it wasn't objective number one. It was like objective number 89 on the list, or 13. Eventually they made it number one, but it was this thing called a security risk assessment. And if you're like me, my partner and I looked at this and we're like, that doesn't sound very hard. We'll just, yeah, we did it. I think we attested 2 or 3 years to saying that we did it and we had no idea what it was because we didn't do it. And I bet some of you probably did the same thing. All right. But the reason it was made part of the meaningful use rule largely is because it had been around for a while and it really wasn't being done. So the government, CMS said, and HHS, which is part of OCR, said, we got to make sure that these covered entities, you all work for a covered entity, right? So because you're a covered entity, you're subject to the HIPAA security rule. We've got to make sure they're doing a security risk assessment. So what I want to tell you is an SRA, security risk assessment, did not come out of meaningful use or MIPS or MACRA or any other incentive program. You're not required to do an SRA because you're attesting to those programs. Do you realize that? You're required to do an SRA, security risk assessment, because you're a HIPAA covered entity. But in order to make sure you're doing it, they've incorporated into programs like MIPS and MACRA and meaningful use. And then you're like me, and then you lie about it. I stopped lying about it after a couple of years. Like we finally realized that it's important. But I'll tell you that the more I educate on this and the more I do this job, the more relevant I want you to realize that the HIPAA security rule is to your practice and your organization. It's as relevant as the privacy rule. And in my opinion, it's even more relevant because you're handling all of their data on computers and on technology. And there are these things called breaches, and we're going to talk a little bit more about that. I incorporate this slide into every presentation. And I also, when I come out on site and I do security risk assessments, which I've been doing these for about 7 years now, and I continue to learn more and more. I share this while I'm doing security risk assessment because I think that it can be very confusing. All these questions that I ask, I want you to have a visual. This is the HIPAA security rule. There's, I think, 42 safeguards standards here that you're required to have in place as a covered entity. So I want you to, you've probably heard and been told, you may know they're broken down into administrative, physical, and technical safeguards. You can see the majority of the rule as it is right now, because it's still from 2005, is administrative stuff. Are we training our staff? Are we doing our risk analysis? Are we sending out reminders? Do we have a disaster recovery plan? So it's administrative stuff. And then about 15% is physical, and 10 or 15% is technical, which is crazy to me in this day and time. And you're going to understand why in a minute. We need more technical safeguards in place because we're dealing with cybersecurity, and it's coming. I expect, a matter of fact, I'm going to probably drive to Washington, D.C. and make my campaign. I'm ready to get up there and say, listen, I'm here to help you rewrite the rule because this is not cutting it, right? We need more technical protocols. And we have resources, and I'm going to share some of that with you. So technical, physical, administrative. I want to make sure that all of our clients that I work with and each of you understand that, the HIPAA security rule is only going to become more and more relevant in your practice. And that's largely because of this. So data breaches. Last year, 2021, saw a record number of breaches reported. These are breaches from HHS website, over 500 or more, which is considered the large category reportable breaches. All right. So in 2021, 714 breaches were reported, and an estimated 90% of those were ransomware, phishing, hacking, cybersecurity attempts. And prior to that, 2020, 642 had been the record year. So let me tell you how I was going along and doing SRAs for the REC from about, I think I started in 2015. From about 2015 to 2019, as I was, learning my clients and learning the security rule and getting better each year at doing a security risk assessment. By about 2018, I had done security risk assessment for same clients year after year after year, and they were doing better and better and better, and their maturity rates, which meant, to what percentage are you mature? How many, as far as all the safeguards that you have in place. You know, do you have 80%? So in the beginning, you know, a lot of people that we worked with, a lot of organizations, they've had, you know, 60, 70%. And we wanted to see improvements, and we saw improvements over the years. Well, by 2019, and even some that I did in 2020, I was giving some of my clients, you know, really good scores, like, yeah, you got a 95, right? And I think I even gave 100. I don't know if any of the hundreds are in this room, but I think I did. Because the thing is, my boss said, why are you giving perfect scores when you know that there's something, you know, and listen, what I guarantee you, I told you when I gave her the 100, it doesn't mean you don't have risk. Didn't I tell you that? It does not mean you don't have risk. Does not mean you are risk free. It meant that over the years, you have taken your SRA and you have applied the mitigation strategies that were recommended, and you didn't put it and file it under B for back burner project, or, you know, T for till next year when Amy comes back, right? You worked on it throughout the year. But guess what? Now my strategy has changed. I am not giving anybody 100 this year, although you may have gotten one, but I didn't give it to you. But the thing is, nobody is going to get 100 this year, because after what's happened, and what does this directly correlate to? COVID, right? 2020 spike. What they do, they found our weaknesses. What were we doing? We were doing meetings online. We were, you know, meeting with patients online, and we were doing everything remote, desktop, VPN, and the hackers exploited us. Healthcare was the #1 target. Security incidents through the roof. And again in 2021, because they just got better and smarter at their game, and they just kept hounding us. That's why I'm here to tell you the HIPAA security rule is now more relevant than ever, because the safeguards that the rule require you to have, they are designed to help you not only protect against a cybersecurity attack, but even more importantly, and I know that sounds crazy, if you do get hit, how to recover from it. All right. I don't know. Is it the big button? Okay. So I read all the time. I love statistics, and you know, I love knowing like what's going on from survey standpoint. These results came from a Sophos. Have you heard of Sophos? Sophos, a cybersecurity firm. Some of you use Sophos products for protection, antivirus, and that sort of thing, and reporting. Their report was based on 381 healthcare IT professionals from 31 countries. Now, this is based on 2021 data, so events that happened in 2021. Even though it's called 2022 State of Ransomware Report. This report was published in February, all right? Their report says 66% of those 381 healthcare IT professionals from 31 different countries experienced a ransomware attack in 2021. The number of those organizations that paid the ransom has doubled year over year, which surprises me. And you know why? Because guess what happens when you have a ransomware attack? Who comes on site? The FBI. And what does the FBI tell you to do? Do they say, oh, just go ahead and fork over the money, they'll give you your stuff back? No. They do not. They say, don't pay the ransom, because in their experience is you don't get all your data back. You may not get any of it back. They have no obligation to make it all work for you again. And I'll tell you that in the earlier days of ransomware, I think that it was more common because the malware was not quite as complicated. They have just really become crazy experts at the way they write these programs to take over your networks. So I'm saying I don't even think they know how to undo what they've done. They just want your money. So, but we're paying the ransom, and FBI is going to tell you not to. And I'll tell you why in a minute. 61% of healthcare organizations paid the ransom. On average, after paying the ransom, healthcare organizations were only able to recover 65%. That's on average. 2% of those organizations, 2% recovered all of their data, which means 98% didn't. All right. So if we're not going to pay the ransom, well, let me share this with you too. So another big report that I look at every year, and this usually comes out in January, but this is based on 2021 as well, the HIMSS Healthcare Cyber Security Survey. Basically, from all of this, even the data that I've shown you before, it all can be surmised that what's your number one threat right now? Is your number one threat information getting faxed to the wrong doctor on the patient? You know, that's a privacy thing, right? Sent the wrong information, or somebody leaving paper on their desk and it getting stolen. You know, I mean, that could potentially be a breach. But when you think about the overall damage and the number of people affected, something like that is not going to affect your organization nearly as much as a ransomware attack. All right. So your number one threat right now is a cybersecurity attack, mainly ransomware and phishingware. Those are phishing and ransomware. Those are the top two security incidents. You know what your number one vulnerability is? All of you, because we're human and we make mistakes and we believe things like we ordered $1,000 phone on an Amazon account yesterday that we know we didn't, but we better click on this link and make sure, right? That's how the stuff gets in, right? So so now you know. It's ransomware we've got to protect against. We got to use the HIPAA security safeguards to do it. Got to have that security risk assessment to start with. And we've got to make sure that our staff and our workforce are trained. All right, ransomware. I know you know what ransomware is, but I put this slide in. I want you to be able to use, you know, information like this when you are working on training resources yourself. So ransomware, ever evolving, it is malware. It encrypts the files on your devices. Your computers are rendered useless, basically. You can't get to anything. And I'll tell you, there have been significant attacks just here in Kentucky alone, even this year, last year, this year, over the past few years, as a matter of fact. But you know what's happening is phishing. You may have heard, you probably know less about phishing than you do about ransomware. What's happening now is these gangs have kind of split up. So we got our phishing gangs and we got our ransomware gangs, like the Bloods and the Crips, right? I'm not on either one of the teams. Phishing, what they've done is they've gotten so good at stealing your credentials by creating those emails and those links and getting you to click on them. And then they take the login credentials and they sell them to the ransomware gangs. So the ransomware gangs can spend all their time making their little programs and their malware and their viruses even better. So they've kind of gotten really smart on how to do this. So we've got to be able to identify what these phishing emails look like. And also from the cybersecurity survey that HIMSS put out from 2021, what we know is that 89% of the respondents to this survey said that those attacks came in the form of emails. So now we know where we're most susceptible. It's email, it's our workforce clicking on the links, right? And ultimately the big damage is releasing ransomware into the network. All right. So it wouldn't be a presentation about HIPAA security if I didn't tell you about a big case. And just so, because I like to learn from these. So OCR, again, Office of Civil Rights, HHS, Department of Health and Human Services. HHS is a cabinet under OCR. They were put into place for investigating breaches. It's their job. So that's who would come on site if you had a major breach. And they would be doing investigations with you, trying to figure out what happened, and ultimately being a part of what comes afterwards. And what comes afterwards if it's a major event, is called a resolution agreement. Now, usually these resolution agreements don't come out and they're not published for anywhere from 3 to 5 years. This one in particular, it took 4.5 years before, and it was just released on the HHS website on July 14th. All right. So in this case, Oklahoma State University Center for Health Sciences settles HIPAA case with OCR, and it's $875,000. This is one of the first real hacking, like a cybersecurity incident that I have read a resolution agreement for. So I was excited about this because I want to know, I read these because I want to know what happened. What did they, like, what happened to them? Did they get in trouble? How much money did they have to come up with? And what were OCR's findings? Because I'm going to tie that back to the HIPAA security rule. So the incident occurred on January 5th, 2018. OCR received a breach notification report from OSU reporting a breach of PHI, protected health information, affecting 279,000 plus patients. Do you want me to tell you what I already know from this? Now, these resolution agreements are always so vague. I love reading them, but then I'm so mad at the end because I want to know more details so I can share with my clients, right? So I can tell from this that that's basically, that could possibly be their entire database, okay? That's 280,000 patients, right? And when that happens, what happens with ransomware these days is you can't even figure out, you can't get past the point of entry to know if your patient's data has been encrypted. Basically, every ransomware attack is now considered a reportable offense with OCR. Whether you have determined that there has been impermissible use or disclosures or compromised data, or whether it's been encrypted, it's reportable. So right off the bat, you've got HHS and FBI working with you. So what happens is they don't know, so they have to figure out how many patients do we have, and we're just going to have to report the whole database, right? The next thing is OSU reported that on November 7th, 2017, an unauthorized third party gained access to an OSU web server by uploading malware. Hacker, that's what that is. Somebody clicked on a link. I know they're not saying this in the resolution agreement, but a third party unauthorized is a hacker and uploading malware. So this was a cybersecurity incident. Then OSU discovered that some of its workforce members stored folders on the web server that contained PHI, including names, numbers, all of this stuff is PHI, right? And they were stored in folders on a web server. And apparently, what I derived from this is the IT department probably didn't even know that a lot of these folders were being stored here. And then they later reported that on September 25th of 2016, it discovered that another unauthorized user had previously accessed the same server with the first date of access occurring. So what's happening here is first they discovered in 2000 that something happened January 2018, but as the investigation unfolded, they realized that these unauthorized users had been lingering around in their system doing things for quite some time before then. And that's not something that HHS is going to be happy about for you. And then at the time of the 2016 incident, OSU reported that it was not aware that there was ePHI stored on that server. What? I didn't know that was there. That is never going to work for you. All right? Never. That's not only will they not care, they're going to make an example out of you. And that's why I'm talking to you about them right now. So what happened in the resolution agreement? What did they find? This is always the part I can't wait to find out. All right, so they found that there was non-compliance with the following provisions of all three: privacy, security, and breach notification. The first one, it was decided that this was impermissible disclosure of ePHI 280,000 patients. That's privacy. Security. Well, failure to conduct a comprehensive and accurate organization-wide risk analysis. I knew this was coming because I've read so many resolution agreements that usually an organization that has been conducting a security risk assessment, they usually don't have this kind of penalty and this kind of, publicity, like with the reports, like it usually doesn't end on such a bad decision. So I knew that it was going to say they don't have a security risk assessment done every year. They also, this is one of the first times I've been waiting to see this. All right. So part of the HIPAA security rule is this thing called evaluation. It is vague. It frustrates me. I have a hard time explaining it, and none of you are doing it. Just know that, right? No, y'all, nobody's doing evaluation. Guess what? You're going to have to start doing it. And as an advisor, I'm going to have to make sure that you're doing it and that you understand it, because now it's showing up in breach settlements. All right. Failure to perform, you have to do technical and non-technical evaluations in response to environmental operational changes. Failure to implement audit controls, and a security incident response and reporting failure. So they didn't have a security incident response and reporting plan. And then the last two were breach notifications. So failure to provide timely notification to the patients, and failure to provide timely notification to the Secretary of HHS, all of which you should be familiar with how to do. And then not only do they had to pay $875,000 in penalty money, but I honestly think the worst and the hardest, most gruesome part of all of this is the corrective action plan that you're always going to get slapped with after the fact. And in this case, it's a 2-year thing. And there's so much to this corrective action plan. This is very misleading. I've just got bullet points here. But basically, you're going to appoint a monitor. Somebody who already has way too much to do in your organization is going to be appointed a monitor, and your life for the next 2 years is going to be spent producing mounds of documentation to submit and send to OCR. And that documentation is going to come in the form of getting they have to get their policies and procedures put in place because they didn't have any. They're going to have these reportable events. So once you get your policies and procedures in place, you've got to train all your staff on it. Then you have to prove that you've trained all your staff. And I need documentation showing that. And then if your employees aren't abiding by it, I want to know their names. That's what the appendix says. I want records of the employees that are not, I've never seen that in a resolution agreement. But now they're pinpointing names of individuals who are not complying with the HIPAA security rule. So then you have to provide training on all things HIPAA security. You've got to submit quarterly reports with proof that you're doing all the things in the risk management process. And then you have an implementation report. So that's the very beginning. And then you have to do these attestations for the next 2 years. You have to submit this big report in the end with all the proof in the world that you are complying. So I would not want to be the monitor in this situation. Just know that corrective action plans are no fun and sometimes end up costing you more than what the initial, like the $875,000 fine does, right? All right, so I said all of that, like to say what I'm doing now when it comes to your security risk assessments. Before I would come in and I would talk to you about every one of these, I would ask you multiple questions about all these safeguards. And for the most part, I would ask for evidence. I would ask for some screenshots and to look at some things, but I didn't really ask for enough, to tell you the truth. And now I am. Now, if you tell me that your backup tapes are stored in the bank across town, we're going to go get in my car or yours, and we're going to drive across town and you're going to show it to me. You know why? Because I was told that by a client for 4 years straight, and they got hit by ransomware this year. And guess what happened? There were no backup tapes at the bank across the town. So I'll never take that answer at your word anymore, but I still like you. But we're going to do it right. We're going to do it right. We're going to do it right because I'm here to help you. All right. And, you know, let me just say this. Earlier in Jessica and Kelly's presentation, they talked about the waste walks. And, you know, Jessica said, you know, don't treat these like audits. You know, everybody in your organization, your least favorite word is audit. Okay. And I get called an auditor. I'm not an auditor. I don't want to be called that. I want to be called a HIPAA security educator, a friend. I want you to know how to make this rule work for you. All right. And I know that you don't have time to sit around and read about this stuff, but I get paid to do it. So I'm going to help you know exactly. And so what you see in red, what I've learned is that these are the safeguards that we are lacking on. We're not doing them, basically. We're not doing them enough of them. They're insufficient or they're lacking altogether. So I did a webinar back in May and I pretty much set it up for this year because we get really busy this time of year with security risk assessments. And I said, I'm coming. And these are the things I'm going to be asking you about. And we're going to be really, like, I'm going to get really tough about it this year. Like, I'm going to ask you, you're going to have to show me, you're going to have to prove it to me, and it's all for your own good. So the security management process, security awareness, I'm going to break all of these down. And I'm going to tell you the things I've been kind of too lenient on. And now I'm going to tell you what you need to be doing because I've already said you're not doing enough of it, right? All right, so let's look at each of these. The first one, this is the cornerstone of the security rule. You got to have a security risk assessment. Okay, well, most of you, I think all of you are doing your security risk assessment. And so part of the security management process standard is you've got to have the security risk assessment. This is the HIPAA rule. You have to do it as a covered entity. But what do you do with the risk assessment after I leave? Ashley said earlier that her security risk assessment sits on her desk all year long. And I can't wait to get there on Tuesday because I can't wait to see it sitting on your desk. I'm going to take a video. You know why? Because she says she refers to it throughout the year. What's not happening is the risk management part of it. When I'm done with your SRA, you're supposed to like look at it and get your team together and be like, we got to knock this out. We got high risk on here. We got to figure out how to fix these things. And we've got to come up with a mitigation strategy. And one person can't do it alone. Your IT director can't do it alone. And a lot of times this falls on the person who's responsible for your IT. Ultimately, I have to tell you, the HIPAA security officer is responsible for all things HIPAA security. So even though a lot of this is being handled by your IT director, if your IT director isn't your HIPAA security officer, it's on you, like whoever the security officer is. And in a lot of cases, even the HIPAA security officer is not well versed on the HIPAA security rule, and they're leaving it to the IT director to figure it all out. When a breach happens, HHS is coming for the security officer. So if you need that to be your IT director, by all means, I think it makes sense. I feel sorry for, I'm sorry that I'm throwing the IT directors under the bus, but the security rule is going to ultimately be far more technical. And then the other thing we're not doing enough of is information system activity review. It shows up in almost every breach settlement agreement that I read. But so I'm asking logs, I'm asking for what your process is for reviewing things like audit logs, access reports, security incident tracking reports. Here's the thing, I worked in IT for a long time. The problem is we're always short staffed. We don't have enough. So the only time we do this kind of stuff is when there's a fire and we got to figure out how to put it out. We got to figure out how to do this proactively. And that's how the security rule is designed. All right. Oh, what did I do with my clicker? Okay. All right. So then the next one is contingency plan. All right. Data backup plan. Yeah. I mean, all of you do have policies that say you have data backup. The ones that I find that I've got to look at harder this year is your disaster recovery plan, your testing and revision procedure, and your applications and data criticality analysis. So why? Disaster recovery. Up until the past couple of years, you probably aren't even thinking about it now. What do we think of when we think of disaster recovery? Fires, floods, tornadoes, right? Natural disasters that I know we had a tornado last fall and we've had a flood this year, but typically those don't come around very often, but we're ready for when they do, right? But what is a bigger disaster that can honestly render you helpless and the entire organization, and on average, by the way, when a ransomware attack does happen, on average, organizations are down without any computer access for 21 days, 21 to 22 days. We have had instances in Kentucky where they've been down for months. All right, so disaster recovery, I need you to be thinking about disaster recovery as it relates to cybersecurity, as it relates to ransomware, because it is far more likely that you're going to get hit by ransomware than a fire, flood, or tornado. So does your disaster recovery policy talk anything about a ransomware attack or a cybersecurity attack? No, it doesn't. I already know, because I haven't found one that has it in there, but it's going to after this year, after we do this SRA. All right, testing and revision. Here's the problem. Here's why ransomware is wreaking such havoc on us in this state and across the country. But we want to know what's going on in Kentucky. It's because we have no plan and no experience responding to and recovering from a ransomware attack. When we get hit, we are clueless. So what typically has happened over the years when I come in and I say, do you have your data backups? Yes. Where do you back them up to? Oh, I got them over here on tape. They're across I got a copy over here in the bank. I've got disk. I've got hard drives. I've got this duplication and replication here, and I'm ready. And I use Fortinet to monitor my system, FortiGuard, and I know if somebody's trying to hit in. I was fooled for a long time, believing that all of these processes were true, and I did. I would look at the FortiGate and I would look at logs, but I believed that the people in charge had a management. They had a process in place, right? But I never really asked them, have you tested your data backups? And so when I ask that question now, the typical response is, well, we get the call every now and then, somebody's always Jane down in HR every 2 weeks, she'll delete some files and we have to go pull it from backup. Well, I'm sorry, that's not a test of your backup data. All right. That's right, Joseph? That is not a test. All right. But that's what I get. That's not a test. What I need to know is, have you pulled your full backups and have you tested them either in a testing environment? Do you have restoration procedures? Can you bring your network back up if it's completely down? Probably the worst case, if you haven't experienced a ransomware attack, probably the worst case you've experienced is maybe somebody ran into the telephone pole down at the gas station, and that's what your hospital runs on. And so the whole hospital lost power for a second till maybe it kicked over to generator. Well, that's a nightmare too, right? However, really, it's just a matter of powering back up, establishing connection to your internet, and then bringing things back up in the right order. But the beautiful thing about that is it usually all comes back on, and in maybe an hour or so, everybody can log back in. When it's ransomware, that won't happen. Okay, you're not going to be able to just flip the switch and everybody's going to be able to log back in. So I need to know, have you tested your backup data? First of all, do you even know where it is? Most of you are running on cloud solutions, and that's what cybersecurity experts think is the best solution, is having backup data to the cloud. And so that's great. But you still need to have restoration procedures. You need to be able to know if your network is down, how are you going to respond? And that's where the FBI says don't pay the ransom, because they believe that if you're following the safeguards of the HIPAA security rule, you have all of this in place and you know what to do and you've tested it. So I never really critically analyze the testing and revision component of this contingency plan, but that has changed. And so you've got to have this written out and you've got to test it. And HHS, as part of that last resolution agreement, that's part of what they are going to assess OSU on, is the testing of these plans that now they're building and putting in place. Applications and data criticality analysis. So one client that I've worked with for a few years, they got hit 2 years ago with ransomware. And I just did her SRA a few weeks ago. And she said, the thing for me was I had an order of operations. I had what I thought was a list of critical applications and what to bring back up. She said, but until we went through this ransomware attack, she said, I had no idea that my list was not the way it would have been in the real world. For instance, she said, I never took into consideration transcription and dictation services, and what not having that for our providers meant. And then just, and then she said printers. She said printers, I didn't take into consideration. Printers were like an afterthought. She said, so it just forced me, like, you won't know really what that true order of operations is. Even when you build it, you won't know, but that's why testing is very important. So again, it's the recovery efforts that are causing us to not be able to get back up and running because we don't have a plan in place and we haven't tested it. She also said, getting hit by ransomware, she said it was the worst thing that's ever happened to us. And I think she's been in that role for 18 years. And she said, it was her words. She said, it was like being cut off at the knees and trying to walk. And they were down. I think they had no access for about 3 weeks. But now what's come out of that is this amazing incident response and recovery plan. So I'm going to get to that. I'm going to get to that now. So this was something else that if you basically showed me that you had an incident reporting form, I would be like, okay, they've got a process in place. This is good. Done. I want a true incident response and reporting plan, and I want it built out because that's what HHS wants. Ultimately, it's about what they want, but I'm trying to help you get there, right? You've got to have a plan. Just like I'm telling you about this client, they had what they thought was a plan and then they tested it and now it's better. But most of the clients that I work with, and there's just no real, so I want it to be catered, or I guess written to a cybersecurity incident, because that's your number one threat. It's not about a laptop getting stolen or, those types of things. It is about the most crippling attack that could happen. So there are some resources that I've been sharing with all of our clients this year. If you've heard of CISA, I think they call themselves CISA. I just can't make myself do it. I want to say CISA. So Cybersecurity and Infrastructure Security Agency, put into place in 2018 by Department of Homeland Security. They are their website gets better and better with resources and information about ransomware. There's educational content, there are plans, there are templates, and I have been pointing all of the clients that we work with to a lot of the resources on there. And then of course there's NIST. And so what I want to tell you, NIST has this framework, because when I did the webinar back in May, and I said the same thing about you've got to have a cybersecurity incident response and reporting plan. You've got to be able to be as prepared as possible to be able to eradicate and recover from this. Then ultimately I got asked, well, do you have a template for that? Well, I don't, but NIST has what they call the cybersecurity framework. So ultimately you need to write this plan, and it is going to take a team effort and it's going to take time to put this together. Identify. One of the biggest things you need to know is, what are your assets? Where is your data stored? You would be surprised at how many SRAs I do. And as I'm walking through the facilities, I'm finding that I'll get told in the interview, we don't store stuff locally on the computers. Nope, they know better than to do that. Nope. I will go into some office every single time and I'll find it. You know where I found it most recently? In the referral girl's office. You know why? Because she has 3 different processes for how to send the referrals to these insurance companies or to these or the referral partners, because maybe they don't use direct but anyway, she had scanning software on her computer, a scanning app, and she's scanning PHI left and right and saving it on her drive. There's no process around backing that up, destroying it, getting rid of it. The IT director didn't know that all of this was being stored on her computer. So I find it stored locally quite often. And I do want to tell you about this too. So the client who the data was across the city and the bank. So this ransomware attack, probably the worst that's hit Kentucky this year. In this case, he said, I didn't know that there were birth certificates being stored on a server down in, I guess in the what is it? The records office, yeah, HIM. So he didn't know that they had birth certificates stored down there. Like the IT director didn't know. Well, that was one of the things he was able to confirm, that those birth certificates got encrypted, but he wasn't able to really determine how much else, like, of the patient databases really got encrypted. So asset management is huge. Identifying, all of the things, basically these first three: identifying, protecting, and detecting. If you have your security policies and procedures in place, according to that first slide I saw, or that I showed you, all of these you will be able to address. You'll be able to refer to your policies for these three in the framework. It's this part that we've got to build out, responding and recovering to it. We're not ready for that. So training. So if you go back to the beginning of the presentation, you said, I told you the number one vulnerability is the human factor, and it's our workforce. When I was at HIMSS in Orlando in March, I asked so many cybersecurity experts, I want to tell my clients how to prevent this stuff from getting in. And they said, there's really no one surefire way to prevent it. But they've got to train their workforce. It's coming in through emails, through phishing attacks. So training can never stop. So one of the things that's not happening is we're not doing enough security reminders. We're not finding content. We're not finding ways to share reminders with our clients. And the other part of the security awareness and training standard is password management. I have to tell this real quick. I did an SRA recently. Okay, I know that all of you know that you should not tape your passwords to your computer at this point, right? So since COVID, I had not been on site to this clients in 2 years. And so, but they love when I come. They are ones like Ashley, they've got the SRA on their desk all year long, and they are constantly making improvements, and they're like a star client. I said, all right. So we did the interview, and they couldn't wait for me to do the facility walkthrough. They had already told me that they still have generic user IDs. So by the way, that's a no. Like, you should not have generic user IDs, but I understand licensing and the cost of it. But we still need to work through that. They'd already told me they had at least one generic user ID. We go up to the second floor, and there's this huge, this is a beautiful brand new building. Nurse's office or nurse's station desk. It's huge and circular, and there's probably 15 to 20 nurses that sit. Now they were, and this day there were only 2 or 3 people there. I usually end up doing facility walkthroughs around lunchtime for some reason. So I'm walking, and they are just so certain I'm not going to find anything, because I'd already told them. I said, I bet you I'll find that your laptop, your BitLocker encryption's turned off. Nope, you're not going to find that. Oh, because I find it every time. I'm like, I'm going to find it. Well, they were right. I didn't find the BitLocker turned off on the laptop encryption. However, I just walk up to this computer, and right here on this beautiful computer is this white sticky label that had been run through a printer, and it was beautifully typed. The password to this computer is, 123 XYZ. And I said, what is that? Looks like a password. I said, it is. And I said, now, what's that generic user ID that you had? I made him give it to me, and I was like, boom, I'm in. I logged right in. I said, good thing I'm not a hacker, and I don't really know how to steal or encrypt your information. But if I was, and then I walked around the whole desk, and I found it on at least 6 other computers. And, they hated that. But password management, got to keep it. Access is one of the main ways that our data gets stolen, right? All right, so moving on. How many minutes do I have left? 9? All right. So when it comes to training, please don't let up on continuing to train your workforce. I know that all of you say you have new hire orientation, and you train and you include HIPAA security content in your new hire orientation and your annual training. Well, that's lovely, but ransomware attacks are happening every day. Did you know that if you go back to the first slide where we said we had 714 reported breaches? Are you all good at math? How many breaches does that average out to per day in 2021? Over two breaches were reported to HHS in 21 per day. Oh, and the other thing I wanted to show you is that we're on par for basically for 2022 on that first slide. If you saw, I think we're at 347. So it looks like that was as of June. So I don't know what the last half of this looks like, but it looks like it's going to be another banner year for hackers, right? All right, so please share with them what phishing looks like. Joseph told me earlier, that's a true story about the $1,000 phone. Somebody clicked on a link in his organization, was it last week or this week? This week, Amazon, it's the holidays. This is when we're ramping up, the ransomware gangs are going to make a lot of money. If they have kids, Santa's going to be really good to those ransomware gang kids because they're making a lot of money off of us paying those ransoms. All right. So don't click on the links. And so Joseph said what he did was first of all, he sat down with the person and he explained to her, here's how you know that these links aren't real. And he educated her. He said, when he clicks on this link, he hovers over the link, not clicking. When he hovers over the link, he showed her how the URL is not an Amazon URL. It's highly, highly suspicious. And he showed her several things. That's key is the education. And then he says he's going to take that same scenario at a staff meeting and train the rest of the staff. All right. So by the way, it's not only our job as management or HIPAA security officers to educate the rest of our staff, but as leaders, we need to make sure we're staying up to date too, right, Joseph? So you got to know what's coming and what's new. And just this week, this Cuba ransomware was introduced by CISA. They're informing us. And out on the CISA website, they will send out alerts. I'm going to tell you how to get subscribed to their alert notification system. But it says, so this is the most recent one. Previously reported by the FBI, these actors have leveraged the following techniques. And so this is how Cuba is getting in. So there's known vulnerabilities in commercial software. It's coming in through phishing. There's also compromised credentials. That's basically harvesting your credentials, and then remote desktop protocols. And I'm really not a highly technical person, but this is information that your IT people need to understand and know. Remote desktop is very common in our practice, and you've got to make sure that your security protocols around remote desktop are tight. Evaluation, here's that thing I said, it's like frustrating, and I really didn't evaluate on evaluation that much, but it's going to be a thing. Periodic, technical, and non-technical. Basically, in other words, how well are your safeguards working? It doesn't mean a security risk assessment. It means from time to time, you're checking that your safeguards are working well. Technical would be things like doing phishing testing, penetration testing, vulnerability scanning. Non-technical can be checklist, doing facility walkthroughs. Just like if somebody had done the facility walkthrough, I'm sure that the password, I think they were mass producing those suckers. They were putting in sheets of labels and printing off those, they had a manufacturing process. It was lean. All right. So we're going to do more evaluation. I'm going to help you figure out how to do evaluation and record it. And then audit controls. Let me tell you one more story about that one client who had that major attack this year. One of the things that struck me, there were 6 main servers. Ransomware got in on one server. It just so happened that one server that it penetrated, or that it had leaked into, months before, it had been determined that server needed a memory upgrade. Memory had been bought for that server, but the memory was sitting collecting dust in the IT office and had not been upgraded. And in the meantime, rather than upgrading the memory, one of the IT analysts decided, let's just turn off the event logging. That'll save on memory resources. Well, guess what? They got hit by ransomware. One of the things that's crucial to recovery is your investigation process. And without server event tracking and logging, you can't do that. So this was a snowball of errors that occurred within this practice. And I've got to tell you this is the most significant thing about that I'll never forget. He said to me, because I had worked on their SRAs for several years before, he said to me, Amy, and this relates back to the security management process that nobody's really doing well enough. He said, he was a fairly new IT director and he had stepped into this, and then 6 months later, bam, ransomware hit. So he inherited this infrastructure. He said, I had looked at every SRA that you had done for us in the past. And he said, we have not implemented one thing that you recommended. So I don't know if we're going to be reaching a resolution agreement about them in 4 or 5 years, but I have a good feeling. Your basic security controls, you should have these in place. Antivirus, backup, email gateway, firewalls, we've got to have these in place, but we need to step it up a notch and they need to be advanced. We need to be doing multi-factor authentication. We need to be doing network segmentation. All right, these are highly technical protocols, and I know that most of you are not IT people in here, and if you are, I've already talked with you about this, but this is part of it. This is how we fight against it, and these are things that will help us recover from it too. Like if your network is segmented, that means it's a lot harder for that malware to attack your entire network because you're putting walls between it, right? All right, and according to that HIPAA, that cybersecurity survey, legacy systems are a #1 culprit. I can't give this presentation without pointing out your legacy systems are causing problems left and right. You've got to get upgraded. If you're running 2008 servers, if you're running XP on desktops, or even 2007, I mean, we can't run unpatched systems. That's a ransomware and a cyber attackers. Absolutely. I know I'm going over, but I'm going to finish. And here I thought I wasn't even going to be able to speak long enough. All right. So we have to make sure that we keep things upgraded and patched. Enhance your training programs and enhance your budgets. I'm going to make a campaign that there's a disconnect between our C-suite and our IT people, and somewhere in the middle of that lives the HIPAA Security Rule. And I see it and I feel the pain for the compliance directors and the security officers that I work with in the larger organizations. And I'm going to work with Brent. We're going to figure out some good resources to help you bridge that gap so that you can get those budgets. We've got to have those people at top being a little more well-versed in IT and security. Oh, okay, this is my favorite. I have to tell you what just happened in September. So one of my star clients, Health First over in Providence, been working with them for years. This guy down here, Jason, is the IT director. And back in May, when I did a version of this webinar, right, on ransomware and stuff, I got a lot of calls and emails after that from my clients that I work with and wanting more information. And Jason was one of them. And he said, Amy, I want to be ready for you when you show up this fall. And he said, so I need to know, what do I need to do to have that cybersecurity incident response and reporting plan done? And I want this and I want that, and send me information. And then in the meantime, he went and coordinated a tabletop exercise of a ransomware attack. Now, we did not take down their network. This was tabletop. But at this table is the CEO and the C everything else, and even a board director, right? All the COs are here, and the directors of everything. They showed up, and we went through step by step over a 2-month, like a 60-day thing. Because usually when it comes into your system, you don't know that client that had that major attack, it was infiltrated in November, and ransomware, the plug wasn't pulled until January. It had lived in the system for 60 days at least. All right, after investigation. All right, so for 60 days, we walked this through. In the corner is a CISO representative, a regional representative. I didn't even know they existed. So kudos to Jason. I think Jason worked with Jennifer Naismith and brought Colin Glover in, and he worked, and then I went down too, and we went through this. Afterwards, everybody at that table were stopping Colin and myself and telling me this was hugely eye-opening. They never thought about what's communication need to look like and who do I need to communicate and all the things that happen with a cybersecurity attack. You don't want to be caught off guard. You need to practice it and you need to test it, right? So out of this, what happened was I showed up for his SRA in October, and guess what he did? He was ready for me. This is documentation of every policy, every incident response, his data backup plan, his disaster recovery has been updated with cybersecurity. This is what I hope to see, Joseph, when I come next year. Like, he's ready. Because if they do get hit by ransomware, I'll tell you what, there will not be a resolution agreement made out of Health First, because this right here is in their favor. HHS knows accidents happen, and we have humans working for us. But this shows they were mitigating and they were doing their best to prevent it, and they were ready to recover from it. Surely I don't have any more slides. Okay, so this is just resources, all right? So if you if you are on the HIPAA app, and I don't know if there's another way, but just get these. These are the templates that I'm telling you about from CISA and NIST to help you write those policies and the recovery plans, all right? And then work with me and Greg next year for your SRA if you never have, and we will continue to educate you on all of this. And that's it. There's the subscription services. Get on the listserv for OCR, privacy and security, and CISA, especially if you're in the HIPAA security or IT role. And there's your letter E. The end. Sorry, I went so over.